So we've got gingivitis. Someone's presented to the surgery and they've gone, my gums are bleeding. Yeah, you've got mild gingivitis. And they've gone away and gone, meh. And that's progressed. What would you expect to see in the oral cavity?
Say it again.
Yeah, a lot of calculus.
Would it be really red?
The gums would be really, really red. Gums would be red. We'd see a lot of calculus. What else? What else to do with our gingiva, with the gums?
It would be lower. Would it be lower?
Good. The gums are moving or the teeth are moving. Recession. So what Nikita said is the gums are lower where they should be. So we can see some of the root when they smile.
Yes.
That's gum recession. So the gum is shrinking away from the bacteria. What else would you think to see? What would you expect to see or the patient present with? Yeah, they could definitely well be in some pain. Yeah, definitely bleeding. Definitely some bleeding. What else? Do you think the gums might be really swollen and bulbous? Does everyone know what I mean by bulbous? Do you know what bulbous means?
Is it like it's like the look of like a pimple? Like is it like really like?
Yeah,
big,
so
red?
bulbous is very swollen to the point where you think you're going to touch it, it might burst. Okay, so very swollen, very bulbous. What else?
Bone loss.
Yeah. Yeah, bone loss. We probably won't see that if we just looked clinically in the mouth, but how would we know if there was bone loss? Yeah, just by clinically looking before an x-ray. How would we know there was bone?
I use the periodontal probe.
Yeah, so there's pockets. The teeth are wobbly. Good job. The teeth will be mobile, is what we'd say. They'd be a bit mobile. And we would also know by pocket depth as well. But some people present to the surgery for the first time like this. Okay? Mobile teeth. Who knows what halitosis is? Halitosis. Bad breath. The medical name is halitosis. Do you think their breath would smell nice with that much bacteria causing all this?
No.
Very smelly breath. And the sad thing is they're used to it. They don't realise. Okay? So halitosis. Halitosis is bad breath. Now that is caused by the bacteria. Okay? Bacteria smells. Infection smells because of the bacteria. So when we've had a really sweaty, dirty day, our armpits smell because it's a build-up of bacteria. Okay? If we're leaving dirt around our teeth, if your children come and they've been playing in the dirt, their feet are smelly, covered in bacteria. Okay?
How about candidiasis?
Sorry?
Candidiasis.
Yep, thrush isn't really consistent with periodontitis. Yeah, thrush would be caused from high blood sugars and things like that in the body. Okay, so these people have not flossed, not had very good oral hygiene their whole life. Okay. Now, one thing that we will do, a periodontist would do, is an aggressive clean. Okay. He has instruments called curettes, or she has curettes that can go a little bit subgingivally. Because these patients have calculus on the roots of their teeth, subgingivally. What does subgingivally mean?
Under.
Yay! I just asked a girl that in the other class and she graduates in like 3 days and she's like, I don't know. And I was like, my class does. So subgingivally, good. So subgingivally, our tooth, I mean that gum looks a bit healthy, has calculus all over it and up here. Okay? There is a chance we might be able to stabilize this tooth by doing something called root planing.
Yeah.
Okay? Now, a periodontist does root planing, and that's where they do our gum flap. Same as if there's an impacted tooth. We're cutting, we're peeling back, we're cleaning the teeth, and we're sewing it back up. Okay?
So they would have to be numb for that if you're pulling.
Oh, they would have to be
yeah,
numb
yeah.
for
I was
that.
gonna be like, I wouldn't want to be awake.
No.
I'd be like, I would want to be numb.
Yeah, no, definitely. Alright.
So what about if gingiva gets some, white stuff?
The gingiva gets white stuff.
Yeah, it's between teeth and gum.
Calculus.
Is it calculus?
Yeah. I have had patients that have come in and it looks like one giant tooth. We've removed the calculus and the tooth just fell out. It was the only thing holding the tooth in.
Oh.
Okay, so it can be quite severe. So let's just watch this little bit. This video will help on the TV. If you can see the TV.
Periodontitis is a disease that attacks the supporting tissues of the tooth. Its attack is at the bone level, and the damage involved is irreversible. This problem is the result of the accumulation of certain bacteria that release destructive toxins. Tartar carries microorganisms. Periodontics aims to eliminate all rough spots that impede the attachment of the gum to the root of the tooth. In the case of periodontitis that is just beginning, the treatment consists of a scaling similar to that done during the regular visits, including the tartar cleaning. The difference is that this one is done under local anesthesia so as to avoid any pain during the sampling of deposits lodged more deeply. Periodontal flap surgery is a technique often used following the failure of a less aggressive approach or when access to the rough spots become difficult because the tartar is located too deeply. Moreover, the lack of visibility adds the difficulty of removing all deposits, thus impaling the healing of the tissues. Periodontal flap surgery consists of shifting the gum to allow a good view of and direct access to the surface to be smoothed down. Bone remodeling can also be done in order to recover the natural anatomy, thus enabling easier brushing and flossing. Once the root has been freed of its imperfection, the gum is replaced and held in place with stitches or glue. Take note that certain surgeries can bring about the exposure of part of the root, which might lead to sensitivity to cold or hot foods. After periodontal surgery, it is very important to have a thorough follow-up so as to maintain healthy gums. A scaling every 3 months is usually suggested. The frequency of the follow-ups will be determined by your dentist or your specialist as the case may be.
Okay, so we've talked a bit about the flap surgery. Her voice was a bit monotone, isn't it? You're going to go home and floss tonight? I might skip through this one a bit till we get to the juicy part. I love this guy, but he chooses the worst music. So here we are cutting that line to peel back the gingiva. That's a scalpel, Grace. Yeah, he's cutting.
Why
So to preserve the gum line, he will cut around the gum line and lift it up that way because we're going for the roots. If we're going for something up here, we'd do a straight line. There we go. So we're just lifting up the gum there so we can expose those roots. So as you can see, we are now exposing those roots. Oh, that's not a peristaltic elevator. That's just a tool we use in oral surgery. I'll go for that with it. For periodontal disease, for root planing. Okay. So now we have to expose the other side. So it's our palatal flap, the other one was our buccal flap. So we call them, just as we would charting, the side closest to the buccal. So just skip along till we get to the planing part. Music sounds terrible.
So I'm the manager of.
So as you can see now, see the calculus, he is now scraping off the roots. Oh, good camera weight there. See how he's doing a normal scale and clean, but we're right up there. See the bone level? That bone level is actually quite low. That's receded quite. So he's doing a scale and clean, but subgingivally. Okay. So why he's so that is what he's getting there is like ulcers or pimples that from infection.
It's better to just take a screenshot and send it to me.
You'd rather have him pulled out.
Yeah, instead of what's that? Flash.
So you can see how beautiful and clean that looks now. Can you see that, Tessa? Can you see how beautiful and clean that is now? Stop doing it. Ooh, an ad came on.